So I'm going to demonstrate the admission process for a patient. Okay, so we're going to use Mr. Sepsis here, Seymour Sepsis, as our patient that needs to be admitted. We know he needs to be admitted because number one, the physician told us he was admitting the patient. And you'll notice that there's this TRAN in yellow. This is your admission orders waiting to be processed by the inpatient nurse. Those will get dealt with by the inpatient nurse, not the emerge nurse. So right now you'll notice I'm on the ED tracker. So I am on the emergency side of nursing, and I'm the emerge nurse handling this admission. So my inpatient nurse comes in and I need to do a transfer of accountability. That's the first thing that I need to do. So I'm going to go to this open handoff screen and I'm going to open off my handoff. And I'm going to go ahead and type in a note for that nurse. So I've completed a note here just describing the patient. He came to the emergency department with lethargy, generalized weakness, had a severe UTI, required some fluids and antibiotics, is feeling better. Patient's alert and oriented, no previous UTIs, no significant medical problems. Last vitals were normal, had a soft pressure initially prior to the fluids and antibiotics, and had a mild fever, which has resolved. No distress, no pain, no concerns at the time of admission. So just a quick brief picture of what the patient looks like, and then we're going to click save for that and put in our PIN. And this is our communication to the incoming nurse. You can also utilize, I will have these SBAR tools printed and laminate. You can actually bring this at the bedside and go through these items with the incoming nurse as well and cover, any labs that were there. You might want to cover, any vital signs. You'll have your triage notes. You'll have all the different pieces of information that came that are attached to the patient's chart based on what was done in the emergency department. And you're going to share that information going through the SBAR with the other nurse. And then once you've completed that report to the patient, you do need to discharge this patient from the emergency department. So you're going to go to your discharge, and then you're going to go ahead and complete. So the discharge problem would have been put in by the emergency physician already. In this case, we don't have one, but that's okay. Any specific instructions that relate to the discharge. So if we know at this point that the patient may have has appointment with cardiology on June 30th, let's just say at 9. We can go ahead and put that information, even though it's not happening anytime soon. We can go ahead and put that so that it gets communicated at the time of discharge. And then the physician will have dealt with these medication orders. The one piece that's important from the emergency department is you do need this ED discharge. So we're going to go ahead and put that the discharge was completed by nursing and patient was accompanied by a nurse coming in, and then accompanied by, well, we can leave that. And so the patient was on a stretcher, mode of transportation. They're not being discharged home, so we're not going to need that. There's no specific discharge instructions for them to leave. Patient belongings were sent with the patient, and then follow-up appointment. So we'll leave most of this unsaid because the patient's being admitted to the unit. So we'll go ahead and save and exit that, and now we've got our discharge assessment. We do need a disposition. So the patient is going to be transferred to admit to another unit. So we're going to go ahead and click that, and we're going to go ahead and click that now. And this, saving and closing this half of it, will now take that patient out of the emergency department. They've officially been handed over. That is the completion of the emerge side. I'm going to continue now. I'm going to go over to the patient care status board, and I'm going to show you what it looks like from that end. So now the inpatient nurse has brought the patient up to the unit and is ready to provide care.